A patient's clinical course is a trajectory through a space of physiological states. Each patient produces one realized path through that space. The patient population defines a distribution over all possible paths. The clinical record tracks information accumulated at each point in time. The transition dynamics specify how likely a patient is to move from one clinical state to another. In discrete time, this becomes a matrix of one-step clinical transition probabilities. The instantaneous rate of physiological change encodes the clinical dynamics. The transition structure is the engine of the patient's trajectory, not the outcome itself. Terminal organ failure is an absorbing clinical state. Once entered, the patient cannot leave it. This is a structural property of the physiological transition dynamics. The stopping time is the first moment the patient enters the irreversible failure region. Passive clinical observation cannot undo physiological absorption. Conditioning on a patient's survival is a change of measure over the existing patient population. Intervention is a change of the clinical protocol that governs future transitions. These are different medical operations. Conditioning on survival does not alter the future physiological dynamics for that patient. Only clinical intervention can do that. Conditioning on a patient's past non-deterioration leaves the clinical transition probabilities unchanged. The Markov structure of physiological progression guarantees this. Conditioning on future recovery, however, violates the causal structure of clinical time. Clinical observation is not clinical treatment. A clinical protocol changes the transition dynamics that govern a patient's future physiological trajectory. The treated patient population has a different long-run outcome distribution than the untreated population. Shifting the clinical transition probabilities away from failure changes the outcome from certain deterioration to possible recovery. This is a change of clinical protocol, not a change of patient population measure. Conditioning on favorable outcomes in observational data is not equivalent to having a treatment that produces those outcomes. Intervention operates only on future transitions, never on the past clinical record. Absorbing clinical states remain absorbing under any passive observational scheme.